Welcome to the Peak Performance Podcast, your guide to optimizing your life one health tip at a time. This podcast is designed to entertain and inform, not to provide medical or health advice. Always consult your doctor when it comes to your personal health or before you make any changes to your diet, exercise, or lifestyle.
Ladies and gentlemen, welcome to the Peak Performance Podcast. I'm Coach Kyle.
And I'm Dr. K. Thank you for joining us today as we discuss IV therapies, specifically IV vitamins. Who are they for? Why should you do them? Why should you not do them? And where should you do them?
This is going to be a fun one, Dr. K. I mean, I've got a lot of interesting experiences with some IV vitamins in a lot of different places, so I can't wait to dive in. But before we dive in, is anything new with you going on? We update the audience about your life?
I don't really have any updates, but I do want to give a little story. When I first met the owner of the practice I'm at, Dr. Goddard, I was like, hey, I want to work for you. The very first thing he does is he sends me a PowerPoint. This PowerPoint is 900 slides long. And he says, okay, well, if you want to work here, then you have to learn this PowerPoint. It was just a PowerPoint about basically every single vitamin IV that you could do and how the combination, how they work. And so it took me like a couple months to get through that thing, but eventually I got through it.
That is wild. Goodness. I mean, I guess that's one way to train.
Right.
I'm actually going through a supplement certification program, so I could be like a supplement master, if you will. And so it dove a lot into vitamins and specific types and forms and their interactions and contraindications. It's very interesting stuff. But for me, I mean, I guess I'm a nerd. I guess most people wouldn't care about the specific forms.
I feel like the people that taking time out of their day to listen to this probably care a little bit more than the average person.
That's true. You heard it here, folks. If you're listening to the Peak Performance Podcast, you are more nerd than the average person. Or maybe you just care about your health a little more.
I think they do both those things already.
That's fair. Okay, well, let's rock and roll. So I go to your office. Mm-hmm. You plug in an IV in my arm.
Sure.
And you pump me full of vitamins. What's there to talk about?
All sorts of things. Here's where I'm going to start this. Before we talk about IV vitamins, let's talk about food. And I feel like we've touched on this in the past, but our soil is getting depleted. So let's say you eat a potato. Our potato is roughly 100 times less nutritionally dense than it was 100 years ago. So you have to eat so much more food to get these same vitamin and mineral levels out of the food. And that's the problem. No one really knows about this unless you start looking into it, but there's a quiet race right now to figure out how to nutritionally replete the soil of all the vitamins that we need without having to interrupt crop cycles. Because if you interrupt crop cycles, then farmers lose money and also our food production slows down.
So you give the soil a vitamin IV.
I mean, I guess you could.
Expensive. There's a lot of work being done here in permaculture and crop rotation and things like that have synergistic effects to rebuild the soil. And animals are actually a big part of that, rotating animals into your crop field. It'd be interesting if we come up with like a scientific solution or easy way to do it without physically moving massive amounts of animals and crops around.
Right. Yeah, instead of spraying Roundup, let's spray vitamins. See how far we get.
There you go. You got to be able to patent it, though, because if you can't patent it, you can't make money on it.
That's true. Well, that's not for us. I don't think either of us has enough money to ever make it that far.
So the soil is depleted of nutrients, which means our food is depleted of vitamins and minerals.
Correct.
So how does that affect our daily lives?
Well, so now there's a second part to it. Sure, the average person, so they've done studies on how much someone retains of the food that they eat. A healthy 18-year-old will keep roughly, I think it's 30-something% of the nutritions that they consume through their food. Someone with gut issues or older people, because your gut abilities decline as you age, keeps even less. We're talking like 5 to 10%. So now you're really, out of nutritionally depleted food, you're keeping less of it, and now really what are you getting? So that's
not much of anything.
That's a two-part problem to it. And that's where IV therapies come in. For those of you that have done IV vitamins in the past, I'm sure you realize, hey, you feel really good. And you may feel like not hungry after doing it because you gave your body everything it needs to function for a while, just like eating lunch.
Yeah, I like that. So there's an issue with our food, and there's an issue with basically our digestion and ability to absorb these nutrients into our body. And
Yep.
so by going an IV route, we skip that absorption. We also skip the food, and then
Yep.
we get maximum bioavailability of these vitamins and minerals.
Yep. So a lot of my patients with gut issues, especially in the beginning, I'll start them on IV vitamins while we're getting into the process of treatment, just to get them feeling better and ready for the next step, which is usually, I call IVs one of two things, either positives like vitamins and ozone, or negatives like chelation, which are removing things from you. So I like to give them a whole bunch of positives first to get them ready for the negatives.
That makes a lot of sense. I think it's a good approach. I think so often we're hit with medicine in a way that's like, hey, this is going to solve the problem. I don't care about the side effects. Do it. But if we can prepare ourselves, we'll come out the other side much better, and the process won't be as grueling.
So when we talk about IV vitamins, let's talk about IV vitamins and their history a little bit and all that stuff. So the original is called the Myers cocktail, founded by Dr. John Myers from like the 70s. And he kept actually his formulation really secret. And when he passed away, his daughter, about 20 years later, released his formulation. I believe her name, don't quote me, I think it was Ashley Myers. But she kind of ended up releasing his book and all the vitamins. So what is a traditional Myers cocktail? Traditional Myers cocktail is vitamin C, magnesium, B complex, B12, and the original formulation, those were put into a syringe and direct pushed. Found most people can't tolerate that, so now it's put into a bag of saline and dripped into you. That's the original formulation. And now pretty much every practice you go to has shifted it somewhat. People add zinc, people add glutathione, people add different minerals and vitamins, whatever they think is appropriate. I can talk about the way we do it at my practice, the Osteopathic Center, because the very first thing people are always surprised by is I show up with a bag of vitamins, and they're paying like $200 for this bag, and it's like this big because it's 100 milliliters of saline. So what we're doing is we are super concentrating our vitamins. If you go and they're offering you your vitamins in a liter of saline, they're diluting them. You're not getting the same effects as when you do them hyper concentrated. And let's put it to people like this. Your car needs a gallon of gas, right? If I give you a gallon of gas, your car is going to do great. But if I take that gallon of gas, and I'm still giving you a gallon, but I put it into 6 gallons of water, your car is not going to be happy. It's still getting that same gallon, but it's not the same effects. Does that make sense?
Yeah, actually, that's a really good metaphor. I never actually thought of it that way.
Yeah.
That's pretty cool. Before we move on, so if you've hyperconcentrated these vitamins and they have a specific effect in the body, but I do want to kind of give like a 30-second snapshot of vitamins and minerals overall. So vitamins and minerals, you've got the big ones that you hear. You've got macro vitamins, macro minerals, and all breakdowns of like how much you need, some in super small amounts, some in medium amounts. The hot ones are, magnesium, calcium. You hear a lot about the B complex. The fat-soluble vitamins are your vitamins D, A, K, and E. And then you go into kind of mineral complexes, which are, there's a lot of them, but molybdenum, selenium, iodine, copper. But one I really want to mention on here, and we'll probably talk about it later, is iron. And that one is often overlooked in relation to how bad of a problem it is. And it's estimated that up to 33% of the population of the United States has iron deficiency currently, something I'm suffering with and trying to figure out right now. So it's a mineral that's not widely, I guess it's a metal, not widely talked about, but it is a very big problem. So that's my 30-second snapshot on minerals. And we probably need to do individual podcasts on certain types of minerals, like the B complex would probably be a great breakdown, and magnesium and other things. But I just wanted to give an overview. So continue.
Yeah. Where should I continue to? Because I kind of lost my train.
You hyperconcentrate into a small bag of saline. This has a specific beneficial effect in the body. What is this beneficial effect? What can people expect?
Well, basically, like you just alluded to, different vitamins have different purposes. And you can't actually overdose on any of the things that we're giving you. Anything extra, you'll end up peeing out. And most people notice that their pee is really usually brightly colored. The B complex is yellow. Every other vitamin, just for the record, is clear. B12 is red. B complex is yellow. Vitamin C has a slight tint to it. It's like almost orange, but not really. Everything else is clear. So just so y'all know. So they have different effects based on different things. So vitamin C, for example, that's the easiest one to talk about. In low levels, it's an antioxidant, it's an immune boosting agent. In high levels, it has a pro-oxidant effect. It supports tissue building, it fights cancer, supposedly, those sorts of things. Magnesium has other benefits. Magnesium is used in our blood vessels, it's used in our brain, it's used in a whole bunch of organs, and the list goes on and on. So as a
Over
general,
3,000 functions of magnesium in the body.
yep, and there's like, was it 30 different types of magnesium?
Yeah, it's crazy.
But what happens is when we give your body a bunch of vitamins, and so I talked about the Myers cocktail. The osteopathic center formulation is 14 different vitamins and minerals. So we really went above and beyond. Because what Dr. John Meyer did was figure out what are the 6 things that most people are deficient in, and give them that. Took it further, and what are the like 10 most things people are deficient in.
Gotcha. I like that approach.
Yeah, more is better usually when it comes to vitamins. So yeah, usually people feel really good. If you don't feel good after vitamins, there's something that needs to be explored.
Yeah, so I've actually ran into this with a couple of my clients, actually, especially my sister and another client I'm working with now. They've been put on vitamins and minerals, and they like get this like tingly sensation. They feel kind of off, and maybe like one of my clients has like loss of feeling in her hands, and crazy things like that. And my theory on that is they've been deficient for so long that the body is now firing up detox pathways and firing up systems that haven't been activated in forever. And so there's this kind of Hertzheimer die off strange effect that's happening.
I can't disagree with you because I really don't have a better theory, so I guess we'll just go with that. I don't really know. I think the other theory you have is the sink effect.
Yeah, that's actually a pretty cool one. There's certain vitamins and minerals, namely selenium. Selenium and molybdenum, I think, are the big ones that come to mind for mercury. Selenium has been shown to take mercury and essentially move it down, the sink effect. So it sinks it into your body from your brain, allowing chelation to be more effective. So strategies like DMPS can then effectively pull it out of your body. It also mitigates the negative effects of heavy metals, but it does not remove them. That's key. So you're not going to remove heavy metals from your body with a vitamin IV.
Okay.
So speaking of chelation, what is the importance of vitamins and minerals while you're doing chelation?
Oh, they're super important. So as you are chelating, most of what they're removing are bad heavy metals, mercury, lead, arsenic, whatever, but they are removing a percent of good minerals and vitamins. So you have to be sure to supplement with, I use orals for all my patients, but every day that they're not chelating, while they're in the process of chelating, they're taking oral vitamins and minerals. And, it's not a crazy amount that they need to replete, so oral is sufficient for most people. I have some people that have really bad GI side effects that I have to do IV supplementation with.
So this is actually an important point, and it might go back and you might reference our podcast on why isn't a multivitamin enough. When you're doing chelation therapy, there are certain levels, and if you get a good multivitamin, it should have almost all of the vitamins and minerals you need in it. However, if you're undergoing chelation therapy, those dosages are not quite sufficient to replete. They are just dosages to keep you like not deficient. So basically, the individual formulations are much more effective when you're going through something like chelation. Higher dosages in DAKE and then vitamins and minerals separately, water soluble.
So just as a side note, you brought up the fat soluble ones, DAKE. You can't do those IV.
Correct. Those are oral.
Or injectable.
There you go.
We can
I'm sure the biohackers out there have a suppository somewhere. I don't know why you would ever do that, but
I don't recommend it. You could do an IM injection of any of them, or you just take them orally, and orally is the easiest unless you're super deficient. If you are super deficient, you want to do 1 or 2 IM injections to catch up and then go to oral.
Yeah. I do like most multivitamins that people are not deficient in vitamin D or those other fat soluble vitamins. Most multivitamins will cover it. But if someone is deficient, getting them back up is not going to be covered by a multi. You need to do specific supplementation with it. Okay, so vitamins and minerals IV, you do a concentrated blend of somewhere between 10 to 14. It is concealed because it is your specific blend and is highly efficacious, right? So people need to fly from all over the country to get your blend.
That's right.
There we go. You heard it here. No, it's just they've done some testing and things and, looked at what is most effective and most efficient in most people. And they've made a certain blend for the osteopathic center that they found to be highly efficacious. And anecdotally, I can speak to the efficacy of it. I feel amazing after those things, unless I screw up my dosages on some things, because last time, this was interesting. You gave me one of those IVs. I did not decrease my dosage of my thyroid, my natural thyroid, NP thyroid, and I was like thyroided out. I was like heartbeat, anxiety, because I believe you have selenium and iodine in your IV.
Selenium, yes. Iodine, no. You can't IV
Okay.
iodine.
Okay. Then it was the selenium, and it just sent, or either that or the detox. It sent my thyroid through the roof, and I actually took it down to a third of my dosage I was on after one e-boot and one vitamin treatment with Dr. K.
I think you were more sensitive than the average person, but yeah, that's about right.
Yeah. That is worth mentioning. I've been experimenting with a lot of these things for a very long time. So now I can bring the best of what I've learned to my clients, but I am very aware of the things I'm taking and what they do and how they affect me.
So you mentioned anecdotally. So you've done IVs with me. You've done IVs at other places. Can you talk about the difference?
Yeah. I've done all kinds of IVs all over the place, and it's I found it's like a 50-50 on how I feel. Sometimes I feel great, and sometimes I don't feel much of anything. And I was actually wondering why this was, and then we had a chat a little while ago, and you kind of explained it to me. So why don't you explain to the audience of why I would feel differently based on where I got an IV?
And so specifically where he got an IV, he's not saying, if he comes to my office 5 times in a row, 3 times he feels good, 2 times he feels bad. He's saying if he
Yeah.
comes to my office 5 out of 5, he feels good. If he goes
Yes.
somewhere else, it's a 50-50.
It's a 50-50 shot. Yeah.
So there are a few different reasons. Quality is really, really important. Same as everything else. You want to, just like you want to eat good quality food, you also want to do good quality vitamins. So we get everything compounded specifically for us. Preservative free is a big thing. You don't want preservatives in your vitamins. Most preservative agent places use benzyl alcohol. Not the worst, not the best. If I have to get something made with preservatives, I just have them use EDTA as a preservative because why not? We're probably doing that on you anyway if you're in my office. So the big thing is quality. The other thing, like I mentioned, we hyper concentrate our vitamins. Unfortunately, not every place does. I've heard places that will say, oh, well, we're going to give you some vitamins, and do you want half a liter or a liter of saline? And it's kind of the illusion of choice, unfortunately, where they're asking, how much water do you want? And we're just going to dilute out your vitamins. It makes you feel good briefly because when you get really hydrated, yeah, it makes you feel better. And I have no problem hydrating my patients either. I'll do it usually before the vitamin IV. We'll, give them a liter of saline, get them really pumped up, and then give them the vitamins.
Gotcha. Yeah. I think you touched on this, but the dosage is very important. You hyperconcentrate, but if you dig into a lot of these pop-up clinics that you just drop in and get an IV at a vitamin IV, and you actually start asking them about their dosage, one thing is they often don't even know. They don't even know if they're using preservatives. The people there, a lot of times they just don't know what's going into it. And then if they do know, a lot of times the doses are way below what is needed to be efficacious.
Right. Yeah. Do you remember you and I were together one time and we got IVs and I was like, I'm just curious. And, I don't really talk about what I do when I go to random places because it ends up me teaching. But I remember asking the person, I was like, how much vitamin C is in here? And she very proudly goes, what was it, 10 milliliters of it. I'm like, okay, but what's the dose? She had to go find the bottle and look it up. So what you guys have to remember is you can get this stuff formulated in any strength you want. And obviously, the more concentrated it is per milliliter, the more expensive it is. So 10 milliliters of vitamin C from place A is not the same as 10 milliliters of vitamin C from place B.
Yeah. And this is a big distinction on like wholesale versus like pharmaceutical, like going to Walgreens. Because a lot of times when you get a prescription from Walgreens in a liquid form or CVS, almost all of those prescriptions are mixed at very, very similar milligrams per milliliter. And when you go wholesale, things change. You can get it any which way you want, any dosage per milliliter.
Yep.
So that's why I've kind of felt the difference between where I go. So if you go get a vitamin IV, you need to just do your research on the place, really go ask them a bunch of questions and make sure that what they're giving you doesn't have preservatives, one, and two, is efficacious dosing levels. Any advice on how to do that? How people can do that?
So honestly, price is the biggest thing. If you go somewhere and they're offering you IV vitamins for 99, I see $99 as a special all the time. I can't make it for $99. So I don't know what they're putting in there, but it's nothing you want. Price is the number one thing. Number two, if you call over there and you ask, hey, what's your dose of vitamin C? And they don't know, that's also a red flag.
Yeah. They should be, the person answering should be able to say, hey, this standard vitamin IV comes with 5 grams of vitamin C.
Yep.
I mean, they should know that. Mm-hmm. That should be a good thing for them to know. That's a good test. I like that. So we talked a little bit about B vitamins, where you should go, where you shouldn't go, a little bit about pricing. I think we should talk a little bit. I think you talked about vitamin C, but I'd like to talk about dosage a little bit more, because you mentioned this antioxidant and pro-oxidant effect.
Sure. Vitamin C probably could be its own 30-minute talk, but we'll kind of surface view it for now and see how that goes. So vitamin C, everyone that, we all know to take it orally when we're sick. You take 1 or 2 grams a day when you're sick. And when you do that, it has an antioxidant effect. It boosts your immune system a little bit, and that's pretty much it. But the higher you go, the more effects you get. So this also comes down to absorption, right? So vitamin C, 1 gram orally is not the same as 1 gram IV. So if we agree on that, then the rest of this continues. So the standard in the Myers cocktail, I believe, is 6 to 8 grams. There's not really a standard, but most people do 6 to 8 grams of it. Once you get above 15 grams, which is considered high dose vitamin C at this point, anything over 15, it turns into what's called a pro-oxidant effect. So it's no longer just reducing inflammation, turning on your immune system. Vitamin C is the building block of collagen. Collagen is what makes up a lot of our tissue. So vitamin C, when you go into high levels, it starts becoming a tissue building block. So I give a high dose vitamin C. I love patients. My injection protocol is we do ideally EVU or some form of ozone right before, and then we inject. And then the next day they come back and do high dose vitamin C IVs. That's like the perfect combo for it. Clean out the body, superoxygenate it, do our regenerative injections, and then give more vitamin C for tissue building, which they need to recover from the injections.
I like that. From my experience too, and I want to speak about this pro-oxidant effect a little bit. It seems to be, you mentioned 15 grams, but it seems to be individual to people. So some people might have an antioxidant effect of much higher if they have that huge need for the scavenging of the free radicals. And some people, vice versa, might have that pro-oxidant effect kick in sooner if they have a less need for the antioxidant. That's what I've heard and seen from people. Does that track?
That sounds about right. Yeah. And so 15 grams is starting dose. I can take people as high as 200 grams.
What is the benefit of doing 200 grams, or what can someone feel? Or,
honestly, if we're doing it over 50, it's probably for cancer. And I don't really want to get too much into that. Call your doctor that does vitamin C to talk about cancer, because it's a highly disputed subject. A lot of overview, a lot of red tape on it.
Gotcha. Wise, very wise, Dr. K, keeping us reeled in as ever. That's why Dr. K is here to monitor us, not make sure we're crazy. And I, on the flip side, is here to make sure that we're at least a little crazy to stay relevant.
Yep. So a couple of things I want to point out vitamin C, because I've had people do this. They forget my warnings. Vitamin C, it actually competes with glucose for the same receptors in the body. If you guys follow that, you can track it out yourselves. But to go back to my point being, diabetics need, I always warn my diabetics, most of them remember, a glucometer is ineffective for 6 to 8 hours after doing a high dose vitamin C IV. It will read super high. It will read 300 to 400. Do not take insulin. You just have to judge it by how you're feeling. And most diabetics can do it by how they're feeling, but don't let someone else give you insulin, because your actual sugar is probably like 90 to 100. If you take insulin, it'll drop you.
Yep. And I've seen this because I've done vitamin IVs with you on my CGM. I've gotten up to 800 and the thing freaks out. It says my blood sugar is 800 and my blood sugar is clearly not 800. It's just the vitamin C causing that reaction. Another good thing to know is if you are doing a CGM for kind of lifestyle improvement, making sure your blood glucose is regulated, not from like a diabetic perspective. If you have that on and you're taking even lower doses, so I was taking a gram in the morning and a gram at bed, and my glucose was reading like 125 all the time. I was like, oh my gosh, am I approaching diabetes? No, it was just the vitamin C. So make sure that when you do a CGM, you cut out your vitamin C supplementation, and it hides in a lot of things, so that can throw off your numbers.
Yep.
We have two more things I'd really like to hit, and then we'll wrap up. Next one is magnesium. Okay. You speak a little bit about magnesium and kind of the effects, basically, the general effects, the big ones.
How about you start us off?
I'll take it. So let's start with the fact that most people most likely are deficient in magnesium. And this leads to muscle cramping, fatigue, weakness, generalized pain, malaise. It's a very wide reaching. It's a mineral, right? Yeah.
Mm-hmm.
Yeah, very wide reaching mineral. It's used in over 3,000 reactions in the body. And a lot of times it can also manifest as mental health issues and anxiety being the main one. So many people are deficient in magnesium, and there are so many ways to supplement with it. The moral of the story here is if you can get it IV, again, it's going to be more bioavailable. Your body's going to be able to use it more effectively, and you're not going to get GI disruption effects. If you're taking serious doses of magnesium that have not been specifically formulated to avoid diarrhea, you will have those GI effects. Anything people should know about magnesium and IV?
So like we mentioned that there's 30 different types of magnesium. The IV kind is sulfate.
Okay.
Just so people know. Actually, one tip. It can tank your blood sugar. Or not sugar, pressure. It can tank your blood pressure. So if you already run low, your doctor should be checking your blood pressure before they give you this. But just be aware it can drop your blood pressure.
There you go. So if you're doing magnesium in an IV and you have low blood pressure, maybe take a little bioidentical cortisol. You didn't hear that here, folks.
No, don't do that. No.
No, it's a terrible idea unless you need it and you're basically being watched over and cared for by a very knowledgeable practitioner. I just want to put that out there. So magnesium supplementation orally. There's a lot of good products out there. I like the BioOptimizers one. I'm able to take a gram a couple times a day, and it does not affect me negatively GI-wise. I will say, anecdotally, the one thing I've felt when doing IV magnesium, if I get over 2 grams of it, I just want to take a nap. I mean, I'm just like, whoa. Is your patients have that?
Yeah, it opens up all your blood vessels, so it runs a bunch of blood towards your brain, towards your gut, towards all these places. It turns on your parasympathetics and makes you sleepy.
Yeah. So I literally had an IV of magnesium with a lot of magnesium in it once, and I was like, I gotta go home and sleep. I don't know what's going on here. So one last thing I want to hit before we wrap up is iron. So iron is not in your cocktail. Is that correct?
Correct. No, it has to be its own IV.
There you go. And why is that?
I think it interacts with other vitamins, minerals, and then it has a bunch of side effects all on its own, usually GI side effects. And then IV iron should not be given lightly. It should only be given if you're deficient in iron.
Yeah, I think the main point here is, a lot of people, estimated 31 to 33% of the population have iron deficiency. Also, a lot of people have iron overload. So you can cause toxicity if you go too far on the high end. So this is one of those things that you need lab markers on before you get an IV of. You don't just do this lightly.
And it's not lab markers from last year. It's lab markers from like yesterday.
Yeah. Dr. K called me on this one. I sent him my lab results from 3 months ago, and I was like, hey, can we do some iron? And he was like, hey, no. And I was like, fine, I'll go back to the lab. So you can do it orally. It's hard for a lot of people to supplement iron orally. If you have gut issues, you start low and slow, and you always take it with a gram of vitamin C to increase absorption. If you're very deficient, IV is the option. But if not, going low and slow orally is probably a good way to do it, as it's much safer, I think, in the long term than doing IV dosages.
Yep. I agree. IV should be a last resort, not a first option.
Yeah. And we'll probably have deep dives into each of these vitamins and minerals on other podcasts. If you guys have a preference of which ones we hit first, there's something you really want to know about, or even questions that you want us to answer, please hit us up on our Instagram. Send us a DM, and we'll either get you on or we'll answer you directly. But we definitely know we have this information. We want to share it with people. If you want Dr. K's opinion on something, send us a message. He'll give you an answer. It's like a free doctor consult. Obviously, it's not medical advice, so don't take it that way. But he can advise you. And if you want my opinion, for what it's worth, you could have that too. So that's it, guys. Thank you so much for joining us. You can find me on Instagram at ToxinFreeKyle.
And I'm Dr. K, or the OsteoDoc on Instagram. We'll see you guys next time.
See ya.
Thanks for tuning in to another episode of the Peak Performance Podcast, your number one resource for today's top health hacks and facts. You can follow us on Instagram at the Peak Performance Pod or on X at Peak Perform Pod. You can also check out our website and weekly blogs at peakperformancepodcast.online. Again, thanks for watching, and don't forget to subscribe. We put out a new podcast every Thursday. The content of this podcast is provided for informational purposes only and is not intended for the purposes of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the product. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Coach Kyle, Dr. K, and producers, disclaim responsibility for any possible adverse effects from the use of the information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.